I started to self-harm when I was about 10 years old, but in my early 20s, by the time that I was ready to access help, there wasn't much service there for me. I felt even more desperate when people just expected that I wasn't going to get any better, but somewhere at some level I think it made me more determined to turn things around. The concept for Harmless was born out of discussion and experience from myself and one other, Amy. When myself and Amy had the idea for Harmless, we knew what would work. We had a great concept of how we could start putting that into practice, but we hadn't necessarily got the skills and experience that we needed to translate that into action.
A big impact on many people, the services that they provide through the drop-in counselling sessions and the internet and the email support service, which has been really successful.
Amy and Caroline have been a delight to work with. They've got huge vision and they've sought advice when they needed it, when they've had a problem. They haven't buried it under the carpet. They've addressed it. And I'm very pleased to say they're doing extremely well.
Whatever we do now is just a drop in the ocean compared to the need. So our view for the future would be very much to extend our service provision and to be able to roll out our services on a more national basis.
Well, Harmless is a leading organisation in the field of self-harm, and we've been so for many years. So we've delivered training to vast numbers of people from all walks of life. So we've delivered training to professionals, to carers, to organisations, and that's including city councils.
Harmless is a user-led service, so we provide support, information, training and consultancy around the issue of self-harm.
Harmless are a social enterprise. They have a specific vision of promoting recovery for people who experience self-harm, and particularly focus on trying to instill hope and be a completely inclusive service which is open to anybody who approaches them.
They collaborate with NHS services.
They're a national organisation, but I guess I feel that we're lucky that they are based in Nottingham. So they do offer national services like their website and email support, but they also do a lot more for the local community in terms of more direct work.
I think one of the really refreshing things about Harmless in comparison to a lot of statutory services is that they really do meet people who are in a really difficult place in terms of suffering and offer them hope.
So there's a lot of misconceptions about self-harm, but also about the work that we do. So we face a lot of challenges. We do a lot of work to overcome those misconceptions. We try to raise public awareness, challenge stigma wherever we can, and reach out to people that might feel isolated and that it's hard to get help for.